So when people are drinking lemon essential oil, they're actually at a high chance of causing chemical burns. And there have been a lot of cases of people having permanent scars in their esophagus and permanent scars in their intestines and stomach.
Balloons, bazookas, boobies, bosoms, boulders, cans, hooters, knockers, melons, honkers, jugs, rack, tatas, tits, torpedoes, guns, bust, doorknobs, coconuts, and our favorite one, the girls. Welcome to the All About Breastfeeding show, where your host, Lori, highlights mothers just like yourself and goes beyond the surface questions and digs deep so they share not only their joys and happiness in their daily breastfeeding life, but also their pain and struggles and how they worked through them.
Episode number 63, Shannon Becker talking about essential oils. Welcome back to All About Breastfeeding, the place where the girls hang out. I am your host, Lori J. Leisenstadt, IBCLC, and today we continue with part 2 of my interview with Shannon Becker, certified aromatherapist. In part 1, we highlighted Shannon's personal breastfeeding journey. I'm so excited for you to hear all the information she has to share with us in part 2. I have learned quite a bit from Shannon, and now I have more specific tools in my toolbox when working with breastfeeding moms. We are first going to start off with Shannon giving us details about her interest in aromatherapy and her education and training in the use of essential oils. Let's get started. I would like to get into the aromatherapy part of this interview, and I'd like to just start off with you explaining to us about your qualifications in the field, because I really want to hear what you have to say about the safety of essential oils, and I really want for my audience to know the background where you're coming from, how you've gained this information.
Sure. So we talked earlier about my background in science and academic research. When I started having more problems with anxiety and some chronic pain problems, I was already seeing traditional doctors, but I thought, well, what else can I add to it to make it better? You know, almost like complementary medicine standpoint for myself. And so I started reading about aromatherapy and also herbal solutions, and I just never really, herbology has been a difficult thing for me to learn. It's definitely not my specialty, but I really felt kind of at home with the aromatherapy because of major advancements in the field with different chemical assays and approaching aromatherapy from a scientific perspective. So it just really was comfortable for me. So I wound up doing a lot of blends for myself to help myself. Then I decided that I really enjoyed aromatherapy, and so I attended Aroma Head Institute, and I obtained my certification in aromatherapy. And what that means is that I did over 200 hours of coursework. So I did several, 6 to 7, I believe, case studies, and that involved getting their previous history, medications, different scents that they liked and disliked, what their goals were for aromatherapy. With a clinical case study, you start off there, and then you will develop different blends to address their concerns. And then, much like my consultations I do now as an aromatherapist, there's a follow-up and very specific usage directions. And what that meant was that I had practical experience in aromatherapy. And all of these case studies were reviewed by my course instructors, and they suggested any changes or considerations. They also suggested possible essential oils that might be a good alternative if that particular person did not like the smell of, let's say, lavender. So I did 6 to 7 case studies. And then also I wrote a research paper, and the topic of that is the cooperation of lavender and citrus oils in treating chronic anxiety and also situational anxiety. And I was really proud of that paper. I actually wound up publishing that on my website, and so that's available. But what I found was that in situational anxiety, like dentist appointments, surgery.
Are you saying that it might be like when someone might have a panic attack?
Yes. However, a lot of panic attacks are the result of chronic anxiety. So someone might have an anxiety disorder that is chronic, and so that means that it's always there, and it kind of becomes, it's almost like a wave. It goes up and you're more anxious, and then you might be a little more calm a week later. So people who have anxiety attacks, sometimes they're because of a specific situation, like they don't like spiders, and if they see a spider, they have a panic attack. But a lot of people have panic attacks for really general things. So it might be that your plans changed at the last minute, or you have a meeting with your boss. So all of these things are kind of taken into consideration for either situational or chronic anxiety situations. And there's actually been a lot of research done with surgical outcomes and nursing homes. So I was able to look at these peer-reviewed journal articles, and it supported the idea that citrus and lavender together are very effective for anxiety. So for me, that was my research paper for my certification.
And how long did it take you for your schooling?
I think for me, it took 3 months. Fortunately, a lot of the aromatherapy institutes people have the ability to do things in their own time. So if someone devoted all of their time to the course, I think that they could complete it fairly quickly. And then if someone was just working and maybe studying on the weekends, it was okay to take longer.
Okay, yeah, I see. So you're at this point, you're already doing a lot of other things, and you have a child,
yes.
So you're doing it in between.
Right.
So what I'd like to learn a little bit about is the use of essential oils in mothers who are pregnant, women who are breastfeeding, and in infants and babies. So can you talk a little bit about the difference between topical use and oral use and the safety of each?
Yes. So it's very popular for people to talk about putting essential oils in water or using them on your skin. However, the most effective way to use essential oils is actually through inhalation. I really like to explain the science of this. To explain it quickly, when you smell something, it goes through your nose and it interacts with your olfactory system, and that system interacts with the limbic system of your brain. And that part of your brain is responsible for attaching emotions to memories and also processing threats. So when someone has a panic attack, that part of the brain is really in control. So inhalation of essential oils really is a very quick and effective way to use essential oils because it's already using a system that is set up for smelling, the olfactory system and limbic system.
And so when you're smelling,
mm-hmm.
Is there any danger to any population in smelling?
Yes, so there are a lot of safety concerns for different essential oils. One of the essential oils that I often see people suggesting for babies and kids is using peppermint or eucalyptus. And those two essential oils are often used in things like Vicks Vapor Rub. There's a baby Vicks out there. There are a lot of different products that are supposed to be used when you're having trouble breathing, related to congestion and things like that. Because people are wanting to use something more natural, instead of using Vicks Vapor Rub, they'll be attracted to eucalyptus and peppermint essential oils. However, those two essential oils and a few other essential oils actually contain two chemicals that can trigger a response in lungs to suppress the breathing, and central nervous system. So when you're talking about a child who is having trouble breathing and then you use an essential oil that can suppress breathing, that's the problem. So with an adult, those two essential oils are okay because our bodies are more developed. But in kids, it's really tricky, and I always err on the side of caution.
So I want to break that down even a little bit more.
Sure.
When we're talking about little babies and kids smelling, is there a difference between holding a bottle of essential oil under their nose and smelling versus putting it in a diffuser?
So inhalation can actually be done via smelling from a bottle. You can drop it onto Kleenex. You can drop it onto clay medallions. You can put it in one of the oil burners that use tea light. You can use a diffuser, which usually is a machine that uses water, and then you drop essential oils in, and it uses ultrasonic waves to break the oil up into small droplets. Any of those methods are using inhalation.
And is it less if it's in a versus breathing from a Kleenex, just like one or two snips, or sleeping in a room where the diffuser is going on all night?
Well, so physiologically, the part of your nose and the part of your olfactory system that processes smells, I don't want to make too much of the science part of it, but so the scents will go through your nose and they'll interact with receptors. And these basically are, you can think of it as like a lock and key. So they interact with the lock and send information to the brain. So when you're inhaling something, that will saturate. So that means that it will attach to all of those locks. And so when you're diffusing something, you actually don't want to diffuse it for hours at a time. It's most effective to diffuse for 10 minutes and then turn it off for 20 minutes. And I think anyone can understand that. You know, you go away for vacation and you come home to your house and you can smell what your house smells like versus you live there all the time and you don't really understand what your house smells like. It's sort of the same concept of becoming nose blind to a smell. So continuous diffusing is unnecessary and you're kind of wasting the oil. So the idea of diffusing it all day long, I think, is not necessary.
Wow, that's pretty interesting. It's so different than what I've heard and I read.
Right.
And all the diffusers being sold that are going on all night in the rooms.
You know, I think in some situations where you're looking for help with congestion, that might be better because you're actually asking different tissues to behave differently. But especially with helping with mood, it does become a waste of the essential oils to be diffusing it all the time.
So it's a waste, but not necessarily a danger.
Right. And again, this is kind of asterisked with safety of specific essential oils and also the person who is inhaling them, age-wise and health-wise.
What about when we are mixing essential oils with almond oil or coconut oil and making a lotion out of it?
Right.
And I've heard lots of moms are rubbing different oils on their baby's belly, on their back of their neck, or even on their feet to help them sleep better. Is that entrance into the system less than when you're inhaling?
So actually, it's a little more dangerous because you are applying directly to their skin, and a lot of the chemicals that are contained in essential oils, you know, just like anything in the world, everything has a chemical constituent, and constituent means a portion. So there are lots of different chemicals in each essential oil, and each oil is different. But in a lot of these essential oils, they will be able to pass through the cells in your skin. So the essential oils will be able to travel through the skin and directly into your bloodstream. And so for kids who have underdeveloped organs, especially their livers, it's less safe than inhalation. The other problem that I see out there is most people don't understand how much you need to dilute something. So often I will see recipes for different formulas to rub on your child that are only essential oils and no what we call a carrier oil like olive oil or coconut oil or almond oil. And that's really a problem because you wind up with much more of those chemicals in your body. And really, you're going to be wasting the oils, but what I'm more concerned with is the almost overdose of these chemicals into your body. Most essential oils should be used at 1% dilution. So if you think of percentages, 1% out of 100, that means in a given volume, only one portion of that volume will be the essential oil. So to do the quick math for you, if you have, and I live in the metric world, so in 5 mils, which is approximately 1 teaspoon, you would have 1 drop of essential oil into that carrier oil, and that equals 1%. And for kids and babies, you need to further dilute it from there. So for healthy adults, you can usually use 1% to 4%. And so when you talk to people who are using essential oils, what we call neat, without any dilution, and you tell them actually you can use a lot less, I think intuitively they don't think that's the case because they haven't been taught that. And also, we live in a world where more is better. But with essential oils and medication and everything, I think being cautious and not using too much of it is the best way to go.
Thanks for explaining that. Taking a little break so I can share this info with you. I am really psyched to be able to share this next piece of news with you. My regular listeners are very familiar at this point with Momentum, the organization that I talk about on each show. You know the one that I say saved my life as a new mother, the organization that helped me find other mothers who were new at this whole mothering thing. They became my people. They helped me navigate that first year of motherhood and continued to mother me as I had more kids and my need for support through their toddler years and kindergarten years and elementary school years just kept being needed. I made lifelong friends and they were so helpful that I am doing all I can to continue to support the organization. I want Momentum to continue to thrive, and I want you, my All About Breastfeeding audience, to experience just some of what Momentum is all about. The ladies of Momentum have agreed to give my listeners a 14-day trial membership so you can see what this Mother Center thing is all about at no cost to you. Just hop on over to allaboutbreastfeeding.biz/podcast. You will see a link from Momentum. It's in blue, and you just click it on and it will bring you to the page for you to sign up for your free trial. Honestly and truly, there's absolutely no cost to you. This is just a great opportunity for you to enjoy the discussion groups and the blogs and webinars and educational pieces that are available for free for you. I will have a link to this in the show notes. And now, back to the show. Okay, so can you talk to us a little bit about ingesting the oils?
Yes, there are a lot of people who really enjoy putting essential oils, especially the citrus essential oils, into their water, and then they like to drink that throughout the day. However, if you think about oil and water, oils will float on top of water, and citrus essential oils in particular are very caustic, and the chemicals that are in them are highly irritant to mucous membranes. And so mucous membranes are the membranes that coat the inside of your mouth, the inside of your nose, your digestive tract, inside your vagina, lots of internal spaces that are really sensitive. And so when people are drinking lemon essential oil, they're actually at a high chance of causing chemical burns. And there have been a lot of cases of people having permanent scars in their esophagus and permanent scars in their intestines and stomach. So I have to really caution people not to drink essential oils. And because they float on the top of the water, they actually don't get diluted down. So you're actually going to be coating your mucous membranes with an essential oil.
Is this something that you would know as you're drinking it, or feel that burn, or is it cumulative?
Yeah, I think a lot of people say, I like the flavor, but it burns sometimes. And a misperception that is really common is when someone will complain about something like a rash or something doesn't feel good to the person that taught them about their company's essential oils, they'll be disregarded, or they'll be told that that's how you know that it is working. And so as an aromatherapist, that really alarms me, because I think listening to your body, if something's hurting, that's really bad. And so to me, the more logical thing is, if it's hurting you, maybe be a little bit skeptical if someone disregards it. So if you do find that you're drinking essential oils in your water and you've not had any problems with it, I think that it's highly likely that you will develop some sort of problem, and that might be that you develop a chemical burn or some scar tissue, or what is much more dangerous is that you develop a sensitivity to that essential oil. And there have been a lot of cases of people having systemic allergic reactions, and they wind up in hospitals. So when I say that inhalation is the safest way to use them, I really mean that, because there have been so many cases of people really hurting themselves based on incorrect advice.
So if I'm hearing you correctly, when you're ingesting an essential oil in water, you need to pay attention to the fact that if it's burning, have common sense and tell yourself that's not a good thing.
Right. And I just, I think what I would do is just not to get involved in that situation in the first place. But I think that a lot of people do enter the essential oil world hearing that that's a good way to use them. So I'm kind of realistic that people may not understand that that's not a good idea.
What I'm hearing you say, though, is that is something that is sometimes ignored by others or ignored by yourself, and that is not good. But I think what I really hear you saying is to just not ingest it at all, because even if you don't feel the burning, that more than likely, unbeknownst to you, it is causing other health issues that may come to light later on. Yes,
you did a really good job of summarizing that. Definitely, I live in a land of, first do no harm. And so I think not even starting the ingestion of essential oils, that's the best way to go.
So is there anything a new mommy can do if her baby under 3 months is congested with essential oils? Is there anything that can be helpful?
So I would say under 3 months, unfortunately, aromatherapy is not going to be your best bet. That would be where people would suggest, humidity, lots of nursing. The problem with using essential oils with a baby so young is that their internal organs are not well developed, and they're much more sensitive to anything in their environment. And it's just, I think it's not safe for them to be exposed to essential oils.
So at what age would you say that it's safe to begin to use essential oils with a baby then?
Ideally 6 months, but I think after the 3-month mark, you can be a little more, you can explore some essential oils like lavender. Lavender is one of the most widespread essential oils used. The reason for that is because it has very little chance of having an adverse effect. And it's calming. It has a lot of different uses. So usually at the 3 months to 6 months stage, diffusing something like lavender is safe. I still would be careful about topical applications, because topical applications, so applying to your skin, really are best used in situations where you have to address a specific region of your body, like a skin infection or a painful area. And so inhalation really is the first route to go.
So if a mom wanted to use essential oils, lavender in this case, for helping to calm a child, even like a 6 or 8 month old, to just kind of help them set the scene for bedtime?
Sure.
How would you say that she should go about using the oil?
Well, I think that at least for breastfeeding moms, you're going to be doing breastfeeding. I think a great idea for using lavender essential oils at bedtime would be, if you want to invest in a diffuser, I would look for one that has a timer on it, so it would not be diffusing all night long. So if you were going to use a diffuser, I would look for one that has a timer on it, and ideally these timers would have a short amount of time diffusing, and then there would be a break of no diffusing, and then it would start diffusing again. And the reason for this is that your olfactory system it can become quenched. So when you diffuse something and then turn it off, it allows your system to reset.
So are you saying, I think I heard you say before, like 15 minutes on, 20 minutes off?
That's a good time period. So at bedtime, if you were putting a child to sleep, say 6 to 8 months, I think nursing with lavender oil, either diffusing or dropped on a Kleenex or a piece of dried clay, or even just having a bottle of lavender open on a dresser would be great. All of those methods would be using inhalation, and the child would be able to smell the lavender. And lavender is very calming for everyone. So I think that would not only calm the child, it would calm the mom, which in turn would calm the child. So I think that would be a really excellent usage. And for myself, with my daughter who's 5, I have some clay rocks that we will drop lavender on. And if she's sick, then I'll put a cold blend in there. And so it's not something I do every night. I think aromatherapy is best used for specific reasons, not because it's fun. And so, bedtime that way would be great. As kids get older, it's much safer to use different essential oils. So if someone was, say, 4 years old, using lavender definitely is still great, but you could start adding in things like frankincense, which would help with breathing. You could explore other essential oils just for variety of scent. But at a very young age, I think lavender is the go-to. Citrus also are very safe when they're young.
Okay, I'd like to talk a little bit about the pregnant and breastfeeding mom with regards to, can you talk about what they might be able to use if they had a headache?
Sure. So I think the concern with pregnant and lactating mothers are very similar. So as you know, and probably most of the audience knows, is that when you talk about medications, they will categorize things as Class C drugs. And what that means is that they've not done any scientific research using pregnant women, so they can't say whether a drug is okay or not. And so thinking on that same theme, essential oils are kind of the same. They have not been studied on pregnant women. They've not been studied on nursing women. However, they have been tested on pregnant mice and rats and nursing mice and rats. So all of the empirical data is on a model system. One of the things that is important with pregnant women and nursing women is to not use essential oils that have estrogenic activity. And there are a number of chemicals that are found in a lot of essential oils that do have estrogenic activity. Although herbalists will tell you that using fennel tea is great for breastfeeding, it's actually a bad idea to use fennel essential oils if you're nursing. And the reason for that is it is very high in a chemical that has estrogenic activity, which would reduce supply.
So are you saying that, does that translate to any of the common herbal tinctures that are being sold to help increase milk supply?
So I think one of the confusions that often happens is that if something is in the herb, then it's in the essential oil. Essential oils are distilled from the herb, but if you think about a distillation, you're actually heating something up. So you are denaturing different things in the herb. And then it's being boiled. And then out at the end of the distillation, you're getting a water-soluble part, which is usually discarded, and then the essential oil is a small fraction of that floats at the top. If you compare the chemicals that are in peppermint leaves and peppermint essential oils, they're very different. And so they're not comparative. So, often people will ask, is peppermint essential oil going to make my milk supply drop? And it's not clear, although it seems to be accepted that peppermint tea does do that. In the case of fennel tea, I've heard that it's very good to increase milk supply, but essential oil that has been distilled from fennel actually is problematic for nursing.
And when you talk about topical use,
right,
would the discussion we had before about topical use be the same thing for using a carrier oil such as almond or coconut and adding an essential oil such as fennel to it in the hopes that it increases your milk supply and rubbing it on your breast tissue? Would that not be safe?
Again, if it was diluted correctly, then that inherently would not be unsafe. But there are chemicals in fennel, for instance, that have estrogenic activity. And so you'd be increasing the estrogen in your body, which actually reduces the amount of milk that you produce.
Okay. So is there an essential oil that has been studied to help increase milk production?
I think the short answer is no. And to make it a little bit longer of an answer, the reason why I say no is because most of these studies are done in a model system. So for humans, it isn't really ethical to do these experiments with mothers. And also, so the short answer is no. The long answer really involves a lot of complications with researching using model systems like mice.
So basically what you're saying is we can't use mothers in our studies, so we really don't know the answer to that.
That's right. And we do know the answer of which ones are a problem. We don't really know the answers of which ones will increase milk supply.
So which ones are a problem?
So specifically, anise seed is a problem because it has a chemical called anethole. Also, fennel has high percentages of that same chemical, which has, in those two essential oils, they're about 60 to 95% of the essential oil, and that chemical has been shown to have estrogenic activity. There are different chemicals that have other effects, which are more concerning for pregnant women. So one of the problems with essential oils is that some of them can have teratogenic properties. And what that means is it can cause birth defects. And obviously we're all very concerned that when you're pregnant that your child does not develop a birth defect. It's something that an aromatherapist would definitely know to concern yourself with. Essential oils that contain citral at high percentages is a problem for birth defects. Also, 2 components in cinnamon are a problem, and for those reasons, those essential oils are on the do not use while you're pregnant list.
What are some of the common essential oils that you see being used that you have a concern about for mothers?
A lot of the concern that nursing mothers should think about is that you spend so much time very close to your child, and usually it's your infant and your young baby, that you do have to consider which are safe for them. And so you actually have to kind of navigate what's safe for you as a nursing mother and also what is safe for them. So the ones on that list of what's not safe for that might be a little bit easier. Peppermint is one I would avoid, as well as rosemary. And those two, because they have chemicals that can slow breathing in the child. And it's not clear whether peppermint is safe for pregnant or nursing women. Also, cinnamon leaf and clove bud have chemical parts in them that are not safe for pregnant women or young children. So that would be a consideration. One of the most popular blends out there are Five Thieves and On Guard. And they're super popular because they contain essential oils that have been shown to kill bacteria and viruses. And so these are considered germ fighters. However, when you are applying them to your child, which is something I've seen recommended to to apply the germ blend to your child's feet at night to keep colds away. You actually are exposing them to a lot of chemicals that are not only skin irritants, but can be a big problem for the child.
Yeah, that's a biggie.
Yeah. So in the lab, it has been proven that these essential oils like clove bud and cinnamon leaf are highly effective in killing bacteria and viruses. And that's super appealing for everyone because personally, I don't like using bleach. I think it's dangerous. So looking for a more natural way to clean and disinfect things is very appealing for most people. And these mixes are very effective. However, you may not know about these cautions and these populations that shouldn't be around it.
Oh, you've given us so much information, and I've had lots of questions about the use of essential oil. You've clarified a lot of really good parts for me about the difference between topical and ingesting and smelling. I really like the information you gave about the diffuser. I think that's going to be helpful to many moms. What I'd like to know from you at this point is, I know that you have some handouts, some PDFs that my audience can download, and I'd also like for you to tell me just a little bit about if someone wanted to work with you remotely, how they could go about doing that, because this is again, to me, it's very confusing. You've clarified a lot, but there's still a lot that I don't know. And if I'm a mom and I have a young baby and I want to incorporate essential oils into my lifestyle, I want to really be able to do it correctly and safely. And in order to do that, I think I'd really need to work closely or get some really good info from you. So tell me first about the handouts you have for my audience,
sure,
and then how someone can work with you if they wanted more information.
So my website, my business name is Petrichor Apothecary. Petrichor is actually the smell after rain, so it's a smell that's kind of fresh and nice. I've always liked that smell. An apothecary is kind of the old-timey pharmacies before pharmacists were around. So you would go into an apothecary and be able to buy a toothache powder and also maybe, some soap. And so I really like the idea of, visually of a room with a whole bunch of glass bottles. And so that was the choice for the name of my company. But I do recognize that those are two words that are maybe hard to spell. So I'll spell my website very quickly. So it's petrichorapothecary.com. And to spell that out, it is petrichorapothecary.com. And there's no dash between, it's just all together. Okay. On that website, I have information about myself, and I also have blog posts. And so I like to publish as blog posts versus features on the website. I think it's a little more user-friendly. And so I have that paper about anxiety and lavender and citrus oils already published. I have sort of a worksheet of suggested essential oils by use, and these are also noted for what is not safe for young kids, not safe for pregnant women, and what is not safe for nursing. So that should be helpful, and it's just one sheet, so it's very user-friendly.
Great, because that's going to go over all the things that we may not have had time to do today.
Yeah,
thank you.
And I think that will make it a little easier. I think also what I'll join with that is an easy sheet of the math for diluting things, because for me, I do a lot of math during the day, but I recognize that it gets confusing for most people. I'll be posting that worksheet as well.
Yeah, I'm raising my hand on that.
It definitely gets confusing, and long story. I've been trained to do it, and I do it every day. Otherwise, I probably would also have problems. I also have some other blog posts there about what to look for in a company, and I also address different rumors that are out there, what marketing departments come up with, and, whether you should believe that or not. Sometimes I'll publish about recent fraud alerts. There are companies that are selling what they call essential oils that have come back from chemists as not essential oils. And so I like to keep people up to date on that as well.
Ooh, that's great.
Yeah.
Because there is so much out there that sometimes I just get so confused that I've had periods where I've just put the essential oils aside for a little while because I'm like, is this company good?
Yeah.
Is this one not? Is there ingredients what they really said it is? Is it safe? And it can be real confusing.
And I think there's a lot of concern about customer fraud, not just in aromatherapy, but anything. I mean, one of the Honest Company problems has been exposed that they're using chemicals that are not on the labels. And, so there's a lot of truth of advertising going on out there that is problematic.
Right. So I've looked at that and here's my thoughts is like, so first I want to believe and assume that everything is fine. Mm-hmm. Then I hear that it's not fine and they're using ingredients that they said they're either not or that they shouldn't. And then I don't know if I should believe that.
Right.
Now just because someone says that still doesn't mean that it's not true.
Right.
But it kind of sets me in a tailspin about what to believe or not to believe.
Yeah. And I think that, scientists, we may not do a great job explaining things sometimes. And I think also, aromatherapists are beginning to spend a lot of our time teaching to the public and kind of undoing some of the misinformation, which, I'm happy to do, but I think it's an uphill battle at this point, just in the sheer numbers.
Well, having the handouts that you're going to be sharing with us and having it very succinct with regards to mothers and babies and what's safe and not safe. And then it really sounds like you're going to give us some information about the different companies and the ingredients. And so, I mean, that's going to be a huge help right there.
Right. I think that a lot of people, there are a lot of companies that are popping up overnight and saying that they're selling essential oils. One of the ones that has been most talked about recently is a company that is wholesaling to Walmart, Target, Best Buy, and I think a couple other big box stores. And the chemistry has been done for these, and they are not essential oils. They're fragrance oils. And so all of the chemists and all of the essential oil world is up in arms about it. But it's really not an uncommon thing these days. A lot of times companies will join the essential oil world, and they're run by business people, and they really don't have the understanding of what they're selling.
Yeah, well, it looks like you're going to give us a lot of good information on how to discern between those.
Yes.
At this point, I'd like to know, is there anything else that you wanted to share with my audience about anything else that you have to offer, or anything else that I did not ask you that you think is important for us to know? Sure.
I would always suggest that if you are interested in starting with essential oils, that you speak to or read from certified aromatherapists, because we have gone through the safety training and we have done extensive research. We've been taught what's safe, what's appropriate, the best use for different conditions. Unfortunately, the people that have the loudest voices are not the ones who are trained as well. So the audience should go and talk to a certified aromatherapist. Also, they can talk to someone like me and have a consultation. And I do in-person consultations in Raleigh, North Carolina. I also do remote ones. And in either situation, my consultations involve an intake form that asks about medications, kids in the house, pets in the house, smells that you like, and several other questions. And the reason for that is because I need to make sure that any essential oils I use are not going to interact with your medications, that they are safe to be around your children. I would give you different suggestions of how to use them based on whether a dog, a cat, a child would be around. And also, it helps me to make several test blends that you can live with for however long you want, and then we'll meet back and discuss what you think. And so with a remote consultation, that means that I'll still have the intake form, but I will mail you the samples, and then we'll talk on Skype for the actual consultation.
That sounds extremely comprehensive.
Yeah, I think so.
Tell us one more time how they might reach you, how my audience might reach you. So what's your email address?
My email address is Shannon, so SHANNON, at petrichorapothecary.com. And again, to spell that part is petrichorapothecary.com.
My audience knows that I will have it's great to hear you say it, but if they don't remember because they're driving or doing something else while they're listening or don't have access to a pen, they can always go to allaboutbreastfeeding.biz and they can find your show,
Perfect,
Shannon, and they can look it up in the show notes.
That's great.
Thank you so much, Shannon, for being on the show. You gave us tons of really valuable information in the world of essential oil. I love the fact that you're a breastfeeding mom who was willing to share your story and be transparent about the fact that, hey, I grew up in a crunchy household, and yet, guess what? I still had some breastfeeding challenges. I overcame them. And I also really like that you talked about the weaning process and how that was a little bit taken out of your hands. And I think especially as a crunchy mama, we just want the world to think we're just going to go as long as we want to.
Definitely.
And like I said, we don't live in a perfect world. So I appreciate you sharing that part of your story too. And I thank you so much for being here.
Thank you for having me. It was a pleasure.
So here we are at the end of a 2-part show with Shannon Becker, certified aromatherapist. I hope you learned a ton of really good information. And don't be shy about contacting Shannon and let her know what you thought about the show and ask her any questions that you have. Until next time, bye-bye.